You have cancer. These are the two scariest words that anyone fears hearing in their lifetime. But why does it occur? And why does it happen at this particular time in your life? I'm Dr. Vasyl Chaika. Stay with me until the end, and in this video, you'll find out why cancer really develops and what you need to do to avoid getting sick. In medicine, cancer is defined as the division of cells. When cells divide, we can call this cancer. And this might come as a shock to you. How? After all, cells are dividing constantly throughout your entire life. Your stomach cells divide, your liver cells, breast cells, prostate cells, intestinal cells, all of them divide. This happens every day. So what is cancer then? Medicine considers that when the number of cells with two nuclei, that is, when a cell has two nuclei and is ready to divide, exceeds a certain threshold, some arbitrary number determined by researchers, this is called a malignant process. But that's not really the case, and today we'll break it down together, because cell division that occurs in our body, on the one hand, can enhance the function of an organ, for example, the stomach, intestines, prostate or mammary gland, or it can happen when our body is healing, like when you cut your hand and your cells start dividing as well. Or when you have an injury, like a bone fracture, for example. For the bone to heal, your cells also start dividing. So, does that mean you get cancer? No. So let's look at this from a comprehensive approach that takes into account how our body works, which is controlled by the brain. And this brain has a channel for perceiving information. And yes, in order for any change to occur in our body on a physical level, meaning the number of cells increases, decreases, or changes at all, a specific reaction needs to be triggered in us, which is called a reflex. And it will only be triggered if a person finds themselves in conditions that are automatically, not by their consciousness or intellect, but by what we call the subconscious or the automatic functioning of the brain, perceived as an unexpected negative, isolated situation. Unexpected means that on that day you did not know it was going to happen, or at that very moment you were not prepared for it. Negative because it may threaten your life or your existence. And isolated means that you are left alone with this situation. For example, you wake up in the morning, get a call from the bank, and they tell you that you are bankrupt. And for you, this situation may be unexpected, negative, and it will trigger the corresponding reflex reaction. As soon as this situation is triggered, the body instantly switches to a specific mode of operation. This is called the active phase. During this active phase, the sympathetic nervous system is activated, meaning its activity increases and certain changes occur at the organ level. So, what will happen to us from a comprehensive approach perspective? At the brain level, the corresponding center is activated, which controls a certain group of cells and sends a signal to these cells. What general symptoms will appear when this situation arises? So, first, I want you to listen very carefully right now. The signs of the active phase are increased secretion of adrenaline, noradrenaline, and cortisol, capillary spasms, which means cold hands and feet, especially at night, and the person starts to feel cold. This includes decreased appetite or a complete loss of it, and sleep disturbances. A person starts sleeping poorly at night, constantly waking up. This is often confused with and called stress. No, this is the activation of the sympathetic nervous system, also known as sympathikotonia. In this case, it is the active phase of any reflex. As soon as this active phase ends, the following symptoms appear. This is recovery, the body returning to its baseline level as it was before the reflex was triggered. What symptoms will we see here? The autonomic part of the nervous system is activated. We become sluggish, weak, and tire quickly. We have no strength. We constantly want to sleep. Fluid accumulates in the area where changes occurred in that cell, as well as in the control center at the brain level, and we develop additional symptoms such as headaches, increased body temperature, pain, and discomfort. Everything that we call a disease. So, what is important for us here? It is that cells can divide both in the active phase and in the recovery phase. So, where does cancer arise? Let's try to answer this question now. In medicine, there are about 640 theories as to why cells start dividing, and none of these theories can be repeatedly proven in practice. But when we look at our body and its functioning comprehensively, we can easily assess this. And we don't need medical knowledge for this. We need biology. We have to go back to 5th or 6th grade. Or maybe, for some of you, this comes up even earlier, when we studied human biology. And there we'll see that as we develop, and this is true for all living organisms on the planet, our body is made up of three, or rather develops from three types of tissues, which are called germ layers. The inner germ layer consists of the so-called organs that have cylindrical epithelium. This includes the liver, thyroid gland, pancreas, mammary gland tissue, and the entire intestinal epithelium. This is cylindrical epithelium. This is connective tissue, or what is called the framework. These are muscles, bones, blood vessels, and lymphatic capillaries. And the outer germ layer, it develops into flat epithelium, which covers biological tubes. These include the excretory ducts of the thyroid gland, the excretory ducts of the liver, the lesser curvature of the stomach, the esophagus, the airways, the nasal cavity, the maxillary sinuses, and the rectum. All around there is flat epithelium. And once you know this, now you can answer what cancer is and why it developed in this particular process for you. And for this, you need to know which organ it is and what type of epithelium it has. So for example, if we take the liver has cylindrical epithelium. If we fall into a reflex that we interpret as hunger or deficiency, in that case, a reflex can be triggered. This can be a physical factor, for example, when a child has nothing to eat, literally nothing to eat. Or, for example, another situation when a person is fired from their job unexpectedly and now they don't know how to feed their family. Or bankruptcy has occurred. Or, for instance, they don't know how their family will be able to eat because they are living in poverty. This is enough to trigger the reflex. It activates, and the person can't find a solution for a day, 2, 3, 4, 5, 7, or even a month. And during this entire period, while the reflex remains active, the liver cells begin to divide. For what purpose? Have they gone wild? No. To enhance the function of the organ. Because in order to survive biologically, when there is no food, whether that's real or perceived, it doesn't matter to the brain anymore. The brain gives the command, the organ's function increases, and the cells begin to divide. Or there's another option. A man lives with his wife, and then the man finds out that his wife has cheated on him and is going to her lover. In other words, he loses his biological mate. He is no longer the same male he was before, and now the brain tries to help him. How? By enhancing the function of the organ. Which one? The prostate. And if he doesn't find himself a woman within a week, 2 or 3, and in his mind he keeps losing her because he's a lesser male, the brain will give the command for the prostate cells to start what? Dividing. For what purpose? Did cancer attack? No. The function of the organ is enhanced through cell division. Or another situation, for example, when a person, they were told that they are a bad worker. Or for example, a husband told his wife that she no longer attracts him. In other words that I cannot accept or, figuratively speaking, digest, and that's enough. If a person fixates on this and keeps thinking about it, that it's unfair to them. So, in fact, on the level of perception, I can't digest the information I heard. In this case, it won't be the liver reacting, it won't be the prostate reacting, but rather the organ responsible for digestion will respond. That's the stomach, and the cells of the greater curvature of the stomach will start to divide. So, does that mean cancer has attacked? No, the function of the organ is simply being enhanced. That's what happened. And during this period, if the glandular epithelial cells are dividing, or what is called adenocarcinoma, the person will have a lot of energy, will be losing weight, will have cold extremities, will constantly feel cold, and this is what is called cancer. But in others, it manifests differently. For example, when for no apparent reason a person becomes lethargic, weak, develops a fever, and this lasts for several weeks. They don't know what the diagnosis is, and the person starts coughing. They look with a bronchoscope, and to their horror, they see that cell division has started there. But since that's squamous epithelium, they'll usually make a different diagnosis there, which is called carcinoma in situ, or in some cases, squamous cell carcinoma. So what exactly is the problem? The problem is that before this, the active phase of the reflex was at work. The person was in conflict with someone. There was some real or virtual enemy, whether another person, problems, or life situations. It doesn't matter. He was in conflict, resisting this. And as a result, the bronchi reacted. How exactly? During the active phase of the reflex, when he was nervous, not sleeping, not eating, it was thinning. There was no cell division because this is a biological tube. It's flat epithelium. As a result, when the reflex stops, this epithelium needs to quickly recover back. How exactly? The epithelial cells start to divide, and during this period, which is already the healing phase, the person feels sluggish, weak, and that's when they discover that the person has squamous cell carcinoma, for example, of the bronchi. So what? Has cancer attacked again? No, the healing process has begun. Or here's another version of the same situation. For example, the mammary gland. So for some unknown reason, a woman finds a lump in her breast. And oh, she's worried. She doesn't know what to do anymore. It's scary. Why did this happen at this particular time? She became lethargic. She became weak. They say it's cancer eating you. In reality, no one is being eaten by anything. In fact, this is once again a reflexive situation, and let's trace why this happened. So first of all, if we know how the body works, then in this particular case, the appearance of discomfort and pain are already symptoms. This is already the healing phase, the swelling phase. That is, before this, there was another situation. It was in the active phase. So what happened? And these are the mammary glands. This is the reflex of caring for the family. For example, she might have been worried about her son or her husband or her father or her mother because some problems arose. And as soon as this situation ended, the cells that had been dividing in the active phase became what? No longer needed. So how does the body get rid of these cells? Water is pumped in there. Pain arises because this pain is a mechanical spatial stretching, and these cells gradually begin to disappear in their own ways. That's what happens. But during this period, what is the person diagnosed with? A terrifying diagnosis. But there is no terrifying diagnosis. It's just a lack of understanding of how these processes arise. So what should we do? How can we protect ourselves from cancer now? I am convinced that only a comprehensive approach will allow people to stay healthy in today's world. A comprehensive approach is when we consider a person based on the physical body, which is controlled by the brain, and this brain has channels for perceiving information. These are sight, hearing, smell, touch, tactile, and emotional sensations. In order to protect ourselves from cancer, we need to clearly understand what is happening to us. And to prevent prolonged cell division in the active phase or prolonged division in the healing phase, we need to avoid staying in a reflexive situation. That is, we need to clearly recognize that as soon as we lose our appetite for a day or start sleeping poorly, what we call stress, we must get out of that state as quickly as possible. Lower the significance of this situation, resolve this situation, or simply stop paying attention to it. In other words, interrupt the active response of the reflex. If the active phase of the reflex lasted only 5 to 7 days, then the recovery phase will also last just 5 to 7 days. Nothing will happen there. But if it lasted for a month or two, then during this period, many cells can form. If it is cylindrical epithelium, then during the healing phase it will swell and there will be corresponding symptoms. If it is squamous epithelium, for example, the same bronchi, visible bile ducts of the liver, the lesser curvature of the stomach, then in the healing phase a lot of epithelium was lost during the active phase, and in the healing phase it needs to be restored. What will it do? It will start dividing intensively, and this will also be called cancer. So, in order to avoid these changes, you need to identify the reflex and quickly move into the healing phase. That's all there is to it. It's all very simple. So remember, there are no terrible diseases, only a lack of knowledge. And when you clearly understand how your body works, you know what to expect in the active phase, what to expect in the healing phase, how they progress, and most importantly, what you need to do during them. Any illness can be cured. This was Dr. Vasyl Chaika with you. If you think this video is interesting, share it.